more than you deciding if you want to go for clear aligners or braces, first get a OP done. Let the orthodontist tell you how complex or how simple your malalignment is. And based on that, we will tell you if braces are a better option for you or clear aligners are a better option for you. How do clear aligners exactly work? How is a plastic tray going to align your teeth? Coming to braces, it's advantageous for us because you have to keep coming back to us every month for an activation or for tightening it. And we get to see how you're maintaining the hygiene. We get to see how much more force I can apply. So the most frequently asked question is, what is the difference between clear aligners and braces? Clear aligners, as the name suggests, they're transparent. Nobody really knows that you're undergoing alignment or you're getting your teeth straightened out or corrected. So the most important point you need to remember is more than you deciding if you want to go for clear aligners or braces, it's always better to come and meet the orthodontist in clinic. First get a OP done. Let the orthodontist tell you how complex or how simple your malalignment is. And based on that, we will tell you if braces are a better option for you or clear aligners are a better option for you. The most frequently asked question next is, how do clear aligners exactly work? How is a plastic tray going to align your teeth? So it's not one plastic tray that we give you. It is a series of plastic trays. So when you look at aligner treatment, based on how complex your malocclusion is, once we do the scan in-house, we send it to the lab. The lab usually gives us something called the simulation, where they move your teeth individually and bring them out into a single arch form, a smoother arch form. Align all your teeth in such a way that the back and the front teeth are sitting one on top of the other. Once we say okay to that and we show you the plan and you also approve the plan, we go ahead and tell the lab to fabricate your aligners. Once your aligners are fabricated and they are sent back to the clinic, we give you an appointment, and that will be the first appointment where whatever treatment is done before we actually deliver the aligner has to be done on that day. So there are a couple of steps called interproximal reduction. There's a cleaning that we do before that. There's something called attachment bonding that we do. So most of you must have seen a lot of patients who are undergoing aligner treatment have some buttons stuck on their teeth. We usually use tooth colored cement to place those attachments onto your teeth, which help in moving the teeth faster. So if an attachment breaks, it's not that your tooth doesn't move at all, but the desired movement is usually not seen in the number of aligners that the lab has promised us that it would move. So once we start your first aligner, you will be wearing each aligner for 14 days. Some simple treatments require only 10 days of each aligner wear. So let's say hypothetically I give you about 10 sets of aligners, one set consisting of an upper and one lower aligner. Each aligner to be worn for a minimum of 14 days is basically 2 weeks. So when you calculate 10 aligners, the duration of your treatment is around 4.5 to 5 months, because every 2 weeks you change, and that's how you come to the 10th aligner. So by the time you reach your last aligner, which is 10, 20, 30, whatever, your teeth are more aligned and fixed in their final position compared to your first or your mid aligner. Coming to braces, it's advantageous for us because you have to keep coming back to us every month for an activation or for tightening it. And we get to see how you're maintaining the hygiene. We get to see how much more force I can apply. I typically can activate it so much that 3 or 4 aligners will do 1 month's worth treatment when you compare a braces with an aligner treatment. So the disadvantages, if you ask, nothing. With braces, yes, you have braces that are projecting out of your teeth. So whether they're ceramic or metal, there's still something that's projecting out from your tooth surface. So your lips, your cheeks, your tongue, they have to get used to the wire, the braces, the sharp edges, etc. So initially, yes, you're gonna have some amount of irritation, some amount of inconvenience. Once you get through the first month, you'll actually be completely fine even with braces. We do tell you what to eat, what not to eat. Hard, sticky substances, anything that's pokey, anything that's very chewy, anything that's very fibrous, we usually ask you to be very careful. Whereas with aligners, you do not have to worry about what to eat, what not to eat, because you'll anyway be removing the aligner to eat whatever that is. So advantage wise, with braces, I have more control and I can do more complicated malocclusions. I can treat much more complex malocclusions with braces easier than with aligners. Whereas the advantages of aligners is that it's transparent, it's invisible, nobody knows that you're going through treatment. You can wear them and go anywhere, work meetings, functions, birthday parties, etc.